You ever wonder why a patient who's facing a really serious illness would just say no to treatment that could save their life? I mean, it seems completely illogical, right? Maybe even self-destructive. But what if it's not? Today, we're going to put on our detective hats and solve a real medical mystery. Okay, let's dive in.
So, every good mystery, it starts with a compelling case. We're going to investigate a specific scenario that, believe me, happens in clinics and hospitals every single day, and it leaves a lot of really smart healthcare professionals just scratching their heads. All right, let's meet our patient. He's 55 years old and he has diabetes. Now, his doctor has prescribed some essential foot care. We're talking a simple, non-invasive treatment that could prevent some super serious complications, maybe even amputation. But for some reason, he just consistently refuses.
And that, right there, is the million-dollar question for our investigation. Why on earth would he refuse help that he so clearly needs? Now, this isn't about judging him. It's about trying to understand him. And to do that, we need to start gathering some clues.
Okay, our first stop is inside the patient's mind. We're going to use what I like to call a psychological toolkit to explore the really powerful and often invisible forces that shape all of our decisions. These are the internal clues.
So, first up in the toolkit is something called psychodynamic theory. To put it simply, this is the idea that our past is never really in the past. All those deep-seated experiences and feelings, stuff we might not even be aware of, can bubble up and guide our actions today.
In a medical setting, this can play out in some really hidden ways. Maybe our patient had a traumatic experience in a hospital years ago, or maybe a family member died after a similar diagnosis, creating this unconscious link in his mind between treatment and loss. His refusal might not be about the foot care at all. It could be about a deep, hidden fear.
All right, let's move on to our next tool, behaviorism. This theory takes a totally different approach. It says our actions are less about our unconscious thoughts and more about what we've learned over time. Think of them like habits, both good and bad, that get formed through sheer repetition.
Now, the really hopeful part of this theory is this idea that what's learned can be unlearned. If a behavior, like say ignoring medical advice, is a learned habit, that means a new, healthier behavior can be learned to replace it. It's all about figuring out what rewards or punishments are shaping the current habit.
Okay, our third psychological clue comes from cognitive theory. This one is all about our internal monologue, the conscious thoughts, the beliefs, and the rationalizations we all use to make sense of the world. Basically, what we think is true is what dictates how we act.
So, what might our patient be thinking? Well, maybe it's questions like, is my disease really all that serious? Or, will this treatment even do anything for me? If he honestly believes his diabetes isn't a big deal because he feels fine, then refusing treatment seems perfectly logical to him. His behavior follows his belief, even if that belief is just plain wrong.
So, we've gathered some really powerful clues from inside the patient's head. But here's the thing, to truly solve this case, we have to recognize that the mind doesn't exist in a vacuum. It's time to step outside and take a look at the world around him.
All right, now our investigation gets bigger. We're looking for external evidence, the sociological clues that are all around a patient, in their home, their work, their community. And these factors are just as powerful as our internal thoughts and fears.
This brings us to a huge concept, social determinants of health. This is basically the idea that your health isn't just about your DNA or your lifestyle choices. It's profoundly shaped by your environment, your everyday life.
So let's apply this to our patient. Can he afford the treatment or even the bus fare to get to the clinic? Does his job let him take time off for appointments? Does he live somewhere with easy access to healthy food? His refusal might not really be a choice at all, but a consequence of his circumstances.
A quote from the source material for this really drives the point home. Many diseases are social before medical. Think about that. By the time a patient even gets to a doctor, their health has already been shaped by a whole lifetime of social and economic factors.
And finally, we have to look at the patient's inner circle. These ideas, cultural and family systems theories, tell us that nobody makes these big decisions all by themselves. We are all part of a web of relationships and cultural norms that really influence us.
So, is our patient's family supportive of modern medicine, or are they more into home remedies? Does his culture maybe harbor a little bit of a mistrust of doctors? I mean, a spouse's doubt or a child's encouragement, that can be the one thing that decides between accepting or refusing care.
Okay, we've gathered clues from the mind and clues from the world. Now it's time to bring them all together, connect the dots, and finally solve the case of why our patient is saying no.
See, ultimately, it's not an either-or situation. His refusal isn't just because of fear or because of money. It's way more likely a complex combination of all these things. The psychological factors on the left are constantly interacting with the sociological factors on the right, and that's what creates his behavior.
This actually gives us a pretty clear formula for understanding behavior. A person's mind, their psychology, combines with their environment, their society. That combination leads to a specific behavior, which in turn determines their health outcome. The mystery isn't solved by finding one single culprit, but by seeing the whole system at work. So what does solving this mystery actually mean in the real world? Well, it means shifting our whole perspective. We have to move away from judgment and move toward a much deeper understanding. We're moving from theory to empathy.
For any healthcare professional out there, this changes everything. The goal isn't just to diagnose a disease, it's to understand the person who has it. It means seeing their behavior not as disrespect, but as a form of communication. It's about listening for the clues behind that no.
And this really gets to the absolute heart of it. You cannot force behavior. You can influence it. You can't just command a patient to change, but by understanding the complex web of reasons behind what they do, their fears, their beliefs, their family, their finances, you can start to build trust and gently influence them toward a healthier path.
So, we're going to end with this question for you. A patient refusing care isn't just being difficult. They're a whole person, standing at the intersection of their own unique psychology and their complex social world. They are a mystery, not to be dismissed, but to be understood. So, what clues will you look for?